Earlier this week, Angelina Jolie wrote an editorial in the New York Times about her decision to have her ovaries taken out. It was her second surgery after discovering she carried what's called the BRCA gene mutation. Joining us now is Dr. Anupama Acheson, oncologist with Providence Cancer Center.
Good morning, Dr. Acheson.
Good morning.
What is the BRCA gene mutation, and how does it increase the risk of developing cancer?
The BRCA, or sometimes called BRCA gene mutation, it actually stems from the fact that there are human genes called BRCA1 and BRCA2. And what they do is they produce what we call tumor suppressant proteins. And these suppressor proteins actually help repair damaged DNA in our body, and that helps us stabilize our genetic material. When these BRCA1 and BRCA genes are mutated or altered harmfully, they are not able to do proper DNA damage control, and this can lead to cancers.
How many women are affected by this, and who should be tested?
About 5 to 10% of all breast cancers are from these mutations. And also about 15% of ovarian cancers are from these mutations. So in the U.S., about 1 in 400 to 1 in 800 people have these BRCA1 and 2 mutations. But actually there's a population, Ashkenazi Jewish descent folks, this risk is a bit higher of finding these mutations. About 1 in 40 men and women have the BRCA1 and 2 mutations. So what really determines who should be tested are a few things, such as breast cancer being diagnosed before age 50, breast cancer in both breast and ovarian cancers noted in their family, multiple breast cancers, male breast cancers, and Ashkenazi Jewish descent or ethnicity, as I mentioned. So those kinds of risk factors may be red flags and should be discussed with a primary care physician, and if necessary, should be discussed with a genetic counseling expert.
How expensive is this test?
Usually it depends. The test can run anywhere from a few $100s to a few $1,000s, depending on insurance coverage and also which part of the country you are. So it depends, and those kinds of questions, certainly a genetic counseling expert can help you kind of go through the process and also understand the cost.
Would you say it was medically appropriate for Angelina Jolie to have a mastectomy and removal of ovaries?
Obviously, I do not know Angelina Jolie personally, but what she has clearly well publicized is that she has the BRCA1 mutation. So she carries that mutation, and also she has family history with her mother, and so from her maternal side, women have died with these cancers related to this. In her case, she did do what was appropriate, and it's very clear from the information she has put out in the public that she discussed it very well with her physicians, her surgeons, before arriving at these decisions.
Well, very timely and interesting information, Doctor. Thank you so much, Dr. Anupama Acheson, oncologist with Providence Cancer Center.